Today, we're here to talk about the promise of precision oncology. From a big picture perspective, precision oncology is changing the way we study tumors and the way we treat our patients. The future is a tumor-agnostic approach. In other words, oncology is evolving from thinking about cancer according to the site of origin to thinking about cancer according to tumor genomics. Comprehensive genomic testing is critical to patient care in oncology. It's been estimated that more than 50% of patients may have a potentially actionable genomic alteration. A genomic alteration can be defined as actionable when there is a potential therapeutic target that will help mitigate the oncogenic consequences of the disrupted pathway. Genomic alterations may be treated directly with a targeted agent, or the aberrant pathogenic pathway caused by the genetic defect may be treated instead. So, without testing, we are potentially missing out on a lot of valuable details about the patient's tumor. And that could cause us to miss out on important options for that patient. 25 years ago, when HER2 overexpression became clinically actionable, the groundwork was laid for the precision approach to oncology. In the years that followed, we had EGFR and KRAS as well, which started to show us how the future of precision oncology might look. Genomic alterations like ALK, ROS1, and NTRK had become clinically actionable for certain tumor types, with many more alterations on the horizon. And in recent years, things have really begun to take off. From 2006 to 2018, there was a 7-fold increase in the number of patients estimated to benefit from genome-based therapy. Precision oncology benefits have been reported to potentially include significant improvements in objective response rate, overall survival, progression-free survival, and quality of life for certain well-characterized molecular alterations with approved targeted therapies, compared with conventional chemotherapies approved for the same or overlapping indication and line of therapy. Knowledge of a tumor's genomic profile may substantially impact disease management decisions and patient outcomes. In this retrospective study concerning non-small cell lung cancer, we see that patients that had a specific oncogenic driver who received targeted therapy had a median survival time that was more than 1 year greater compared with those who received non-targeted therapy. In a separate retrospective analysis, patients with pancreatic cancer who received treatment matched to the molecular alterations of their tumors had a median overall survival twice as long as patients with no actionable alteration, 2.6 years versus 1.3 years. In summary, the goal of precision oncology is to efficiently and accurately decide on the most effective approach for an individual patient, taking into account the genomic profile of the patient's cancer.